I'm Dr. Katie Lee, and I am the founder of the Collective Health Society. We focus on doing salivary microbiome testing in our office, which helps us identify the bacteria that are in the mouth that you can't see. It helps us relate those specific bacteria to systemic conditions, but then it also allows us to figure out how to treat the bacteria because not all bacteria are the same and they don't all receive the same treatment. So, what I look for when I'm analyzing the patient's saliva is I want to know what bacteria are actually present. Because most people that are coming into my office are suffering from some sort of chronic illness or they have some sort of vague symptoms with different organ systems in the body. So, based on what they come in with, I want to look to see if there's any bacteria in their mouth that could be contributing to their symptoms. That way, I know that I can target it specifically to get them feeling better. So, what we know is that periodontal disease is actually really common. It's one of the top 10 most chronic diseases in the entire world, and it's on the rise by 34%. And this is because when people come in, they oftentimes receive a blanket treatment for bleeding gums and periodontal disease. Unless you know the specific bacterial profile of the patient and you can figure out what is exactly causing the disease, you can't render the appropriate treatment. So that's why we focus on doing salivary microbiome testing, and that helps us get results. So we know that the mouth actually mirrors what's going on in the body. And so when we see specific signs and symptoms in the mouth, such as acid erosion on the teeth, worn teeth, bleeding gums, an outbreak of cavities, that oftentimes will signal an underlying health condition that the patient is unaware of. And so if we stop focusing on just the teeth and gums, we can really figure out the root cause of the patient's issues, not only treat their issues, but prevent them from having others in the future. So when patients come to the Collective Health Society, we actually have a pretty vigorous intake process where we want to learn all about the patient's oral health and systemic health conditions. We also spend quite a bit of time running several different diagnostic tests because these diagnostic tests will help us see what traditional x-rays and dental exams can't. And by having that information, we're able to treat the root cause of the patient's issues and get the results that they are after. So we had a patient that came into our office that's been suffering for years with what she was told was Parkinson's-like disease. So she had Parkinson's symptoms, but never really received the full diagnosis of Parkinson's disease because she didn't quite fit the profile. When she came to our office, we ran a couple different diagnostic tests, such as an inflammatory biomarker test, an oral microbiome test, a study for sleep apnea, and then we also ran a cellular health test. And what we found is that she had pathogens in her mouth that were directly crossing the blood-brain barrier and creating inflammation in her brain. We found out that she had severe untreated sleep apnea, and cutting off oxygen to the brain obviously is not good for brain function. But the most interesting thing that we found was that she actually had Lyme disease that had embedded into her cells at the DNA level that no one had caught before. So we were able to treat all of these things and detoxify her body, and her Parkinson's symptoms drastically improved. So what's really great is that even though we are an integrated biological office, we still accept dental insurance. And so we accept all PPO plans at our office, including Medicare. And then we also have in-office membership plans that help patients save on average around 20% off of all of our procedures for patients who do not have insurance. We also have partnered with other organizations such as Affirm, Cherry, and Sunbit to help provide financing options for our patients if they need help with payments. We would love to see you here at the Collective Health Society, so please reach out. You can schedule online on our website at www.collectivehealthsociety.com, or feel free to give us a call. Our phone number is 303-223-2343.